Hello everyone, welcome back to Geminic Science. Today we are diving into an important topic in medicine, peptic ulcer disease, also known as the PUD. Let's explore what it is, how it happened, and why it is important to understand. I would like to make things ridiculously easy and explain everything in step by step with the suggestion of diagram to make it more clearer. So what is PUD? PUD refers to open sores that develop on the lining of the stomach or first part of the small intestine, which is called the duodenum. So let's take a very quick revision on this. That is the biology of the GIT. Using this very roughly sketched diagram, notice that from the mouth we have what we call the pelt, which is the pharynx, esophagus, we have the larynx, and here we have the trachea. Notice that this is what we call the large intestine, and this guy here is what we call the small intestine. And on the biology of the GIT, we can also talk about the accessory nerve, which is not really important here. That is the liver, pancreas, and gallbladder. So notice that the small intestine is being divided into three. Let's say we have the small intestine, and here we have the large intestine. This has been divided into three. A very good friend of mine gave me a mnemonic. He said, DJ. Then we should put the I here, which is the duodenum, jejunum, and the last one is ileum. So the large intestine is being divided into three. First, let's get rid of these guys. Moving back to the large intestine, we said it's been divided into three, which is the large intestine. We have the colon, rectum, and we have the anus. But the colon also has been divided into three. Notice that we have the ascending colon, and here we have the transverse colon, and here we have the descending colon. And our anus, we have our anus here. So let's go back to our PUD, which is the peptic ulcer. What are we talking about? The reason why I talk about this, I just want us to understand different type of ulcer. Remember, this is stomach, because the intestine and the stomach are totally different things. Stomach is one which is superiorly, and we have the small intestine and the large intestine inferiorly. Let me take a very quick review. We said the small intestine has been divided into three, large intestine has been divided into three, the colon has been divided into three also, which is ascending, transverse, and then descending colon. Enough of anatomy, let's go back to our pharmacology. Notice that if we have an ulcer in the stomach, this is what we call the gastric ulcer. What if we have the ulcer in the duodenum? Okay, let's take an example. Let's say this is our small intestine. As the small intestine is moving, then here comes the large intestine. And the large intestine starts from at this junction, which ileocecal junction. Ileocecal junction. So this is the small intestine, and this is the large intestine. The large intestine, as the name suggests, is larger than the small intestine. So in some cases we used to have some ulcers that develop in the beginning of the small intestine. The small intestine, we said, it starts from duodenum, jejunum, and then the ileum. So if it's in the duodenum, that is this part, we call it duodenal cancer. Let me write it this way. Duodenal ulcer, sorry, not cancer. What are the causes of PUD? Notice that the most causes of peptic ulcer disease is the Helicobacter pylori or H. pylori. I also have a video on that, which I'm going to drop the link down below in the description section, which will explain everything. This is one of the most talked about bug in the world, and it has some special ability producing an enzyme urease to convert urea into ammonia so that it can be able to sustain and stay alive in a very harsh acidic environment of the stomach. And another thing that causes this PUD is the NSAID, which is non-steroidal anti-inflammatory drug. Example of drug, we have drugs like ibuprofen, ibuprofen. We also have aspirin. What this kind of drug does, they simply erode the stomach lining. How do they do that? Notice that in our body we have these enzymes, which is COX, which is cyclooxygenase. And it's been divided into two, which is COX-1, and we also have COX-2. So, notice that the COX-1 is an enzyme which is responsible for it takes care of the stomach lining and the kidney function. And this COX-2, what it does, it produces, it produces a chemical that makes us to feel pain and, and it also helps in inflammation. So what this drug does, they simply inhibit the action of this COX-1, which inhibition of this COX-1 will cause a problem with the lining of the stomach. And also excessive stomach acid, this can be triggered by stress, spicy food, or conditions like Zollinger-Ellison syndrome. So what if you ask, how does PUD develop? Notice that normally the stomach lining is protected by a thick layer of mucus. When this protection is weakened, acid and digestive enzymes can damage the tissues, leading to what we call the ulcer, or peptic ulcer disease actually. Notice that symptoms of ulcer may vary, but if it happens, it includes burning pain in the stomach, especially before and after meals, and we have nausea or vomiting, black cherry stool, which is a sign of bleeding ulcer. What about the diagnosis? We have the endoscopy, H. pylori, and imaging test. So this is where things get juicy when we talk about the treatment. So how can we face ulcer treatment? First of all, we're going to be using the antibiotics. Antibiotics. Remember, on antibiotics, we said we have two types of antibiotic, which is the bactericidal and bacteriostatic. One to stop the growth of the bacteria, especially the H. pylori, and one to stop the synthesis of protein and DNA, and one to rupture the cell wall and the plasma membrane. Example of antibiotic, we can have things like, let's say, TAPS, Augmentin, 625. But okay, let's take an example with bactericidal, type of bactericidal drug. This is the mnemonic. You can say carbapenems, and amoxicillin are very vital for real microbes. This is going to be aminoglycoside, vancomycin, rifampin, metronidazole, fluoroquinolone, etc. So the next thing which you can use to treat the peptic ulcer disease is the proton pump inhibitors. So normally, even the proton pump inhibitors, I have videos on that, which I'm going to attach everything so that you can understand it. But for this one, the mnemonic is going to be, the good part of it, they end with prazole. Right? Example, you can put raw, something raw, possible raw. So here we're going to have the Lanso, then you add your prazole, omeprazole, rabeprazole. I'm not going to lie, I really forget this one. something esomeprazole. I'm not sure. Feel free to go and check it. So this is it for this problem. I hope you find it very, very helpful. Please, if you do me a favor by clicking on the subscription button. But before we go, why should we care about the PUD? Notice that if we leave the PUD untreated, this can lead to serious complications like bleeding, perforation, and then obstruction. When we said bleeding, we're talking about the ulcers can basically erode the blood vessels, and perforation, a hole in a small wall, which is a medical emergency actually, and we have the obstruction, which is swallowing. How do you pronounce it? Swelling. Something to swell up. Can block food from passing through the digestive tract. So this is it for this problem. I hope you find it very helpful. Thank you for watching and see you next time. Hello everyone. Welcome back to